sacrifice of Jesus Christ and the hope of his resurrection. Join us under the white tent as we offer praise and embrace the true essence of Easter. We urge you to prioritize caution and respect for fellow road users, and remember that kindness, patience and sober driving are paramount. Prayer unites us on March 28th at the N3 Heidelberg Total Energies Petroport.
So our weekend is starting tomorrow as Radio Pulpit. Our weekend starts tomorrow. Berta Leroux and Poputini will be broadcasting live at Petroport on N3 together with the Highway Ministries, praying for people going in and out of Gauteng, going to Durban and everywhere else, passing N3. And then after that on Friday, Bahlenhlapo will be at Zone 10 together with Enika Mantra. They will be at Zone 10 at Lehlabile, go Pastor Mpatswe at By the Stone Azel Church. And then on Saturday, we are also now going to Kwamhlanga. We are traveling, I tell you. We are traveling. We are big on traveling. Itina Labo. So if you are at Kwamhlanga, Enika Mantra and I will be at Kwamhlanga, and we are visiting the Christian Fellowship Healing Church. Yaga Pastor Mkize, Bishop Mkize and Pastor Mkize, Mama Mavis and Pastor Manzini Mkize. Then on Sunday, Ayanda Nemba will be at Rock of Ages in Sekunda at Pastor Mabunda or Dr. Mabunda's church. And on Sunday, I'll be with Undate Muko at the Rent Easter show. And on Saturday, Rifilwe Lamola will be broadcasting live at the Rent Easter show. And on Monday, we close it, broadcasting live on Heart to Heart from 12 up until 3 at the Rent show. We are busy that way, but God is our strength. Let me greet Dr. Tlailane is in the house. That is Hees Basuk met Dr. Tlailane. Hoe gaan dit met u?
They gaan baie goed. I was so scared that the technology is going to fail us.
No.
I was wishing that we were all born in the 2000s, you know. Those people don't have problems with this technology. Morning, Ms. Mongile.
Morning, Dr. Tlailane. Yeah. Dr. Debeila. Wamutla, Dr. Tlailane. Technology is failing us.
Morning, Doc.
Good morning, Doc. How are you?
I'm well, and yourself?
Thanks, man. It's good to hear from you again. I hope it's not very hot that side, no?
Not at all.
Okay.
I'm in the Zim part. I'm in the Zim, the part of Zim that is almost like South Africa.
Oh, okay.
And she says we haven't seen the Great Fire. If we thought we had it in South Africa, we should go to Zimbabwe and see it. But anyway, today we're talking glaucoma. When I read a little bit about it, I'm like, I get confused. Mara like vache black. What is glaucoma? I don't know. When it says it's a group of eye conditions, I'm like, okay, what are we dealing with? Can we throw it to Dr. Debeila to explain a little bit more about that group of conditions?
That's right.
Dr. Debeila?
Okay, I fully understand why you would get confused, because even when I was still in medical school, the definition would still hit me. Like, what on earth is this? And I'm supposed to be like studying and knowing about it. But in simple terms, let's call it one disease and say that it's a degeneration of the optic nerve. And this is usually associated with a high intraocular pressure. When we speak of intraocular, we're talking about pressure inside the eye. So if we talk from a science point of view, anything that exists has pressure in and out. There is even atmospheric pressure. So even an eye inside, it's got pressure that is regulated by the body and the eye system itself.
Yeah.
But the most contributors of these pressures are that there's the aqueous humor, which is the fluid that bathes and gives nutrition to the eye.
Okay.
So when that fluid doesn't drain properly in the eye, for many other reasons, that's why we end up saying that it's a group of disease, because there's going to be having a lot of reasons why there could be a blockage or there could be poor drainage of the water leading to the high pressure. So the only thing that gives, because the eye is a closed system, what gives when the pressure is high. The nerve get pressured and then it gets damaged. And then that's when we say you've got glaucoma.
Okay. Sure. When I heard.
Having said that,
yes.
Then there is then we classify it into two main groups that we've got so-called a closed ankle and an open ankle.
Yeah. You know,
so like I said, there's a drainage system. It's like plumbing. So during the plumbing, it could be that the part where the things drain out, which is the ankle of the eye, of the anterior chamber of the eye, it's blocked. That's why the water can't go out. Or the ankle is wide open, but there's other issues with the structure itself why the water can't go out of the eye.
Okay. I'm going to give Dr. Tlailane an opportunity to also ask something, but when I heard pressure, I remember I ran away from a doctor, an eye doctor, because he did something into my eye with some pressure. And I was like, I keep well. You know, and when I had to go for my second visit, I decided to change doctors. Like, your pressure. Can't see there is pressure, whether from outside or inside, but inside the eye there is one. Dr. Tlailane, I don't know if you want to say, your question to Dr. Debeila.
Yeah, actually, following what Dr. Debeila was saying, I got a bit scared when I had to go and check about glaucoma.
Yeah.
A survey which was ran by the American Academy of Ophthalmologists, which showed that about 96% of us primary health care doctors have got a problem with glaucoma, in that we are not able to recognize it, and we can't even recognize the patients who are at risk. And as a result, it falls upon us to be responsible for all this blindness that we are seeing, nowadays at corners, at robots and what have you, all because of, we
it
are
was not identified.
Yeah, it wasn't identified by us.
Yeah.
Because Dr. Debeila, they see only the referrals from us.
Yes.
And then so I think this talk actually is going to also empower some of us.
Yes.
So that we are able to recognize and refer quite in time.
Yeah.
Before any complication.
Dr. Debeila, if you can clarify that part a little bit, so that that what Dr. Tlailane is talking about. Dr. Debeila, yeah.
So let me start by saying that that March, we are at the end of March, but March is glaucoma month, where we keep doing a glaucoma awareness in March. And the reason for that is that this is a silent blinding disease that is asymptomatic for most of the time until it's quite late. So for the people that are really like having a low threshold of complaining or have a high functioning, by the time that they see that they've got glaucoma, they've got like 50% of the damage to the nerve. But most of our elderlies out there, when they come, it's advanced with almost 90% damage of the nerve, because it's something that is not easy to be identified by anyone, because the patient doesn't have complaints until it's quite late. So Dr. Tlailane, you shouldn't be feeling bad about that. And that's why we also advise that there should be screening. We're making awareness this month about that people should be screened. And from the general practitioner point of view, I would rather actually give the patients the guidelines of them getting screened. And the screening, they can either go by to an optometrist that will be able to do a fundoscopy for them, or to an ophthalmologist, or the physician if they can do fundoscopy. Or in today's days, Dr. Tlailane, you're complaining of technology, but telemedicine, it's becoming a thing that you're going to have to deal with, where you have a fundus camera in your rooms, and then you take cameras and then you send them to an ophthalmologist for interpretation. So that is one definitely thing that will work for general practitioners in terms of screening.
Are there some common signs, Dr. Debeila? Like, we know if somebody's coughing, sneezing, runny nose, maybe that can be flu, or, So is there an easy way, like normal, common things that would point that it might be glaucoma?
Yes. The symptoms, when they come, unfortunately, it's too late. So the symptoms include, if you've got the ankle closed glaucoma, so the pressure would spike quickly. So a person will complain of a red eye, and very severe pain that may even be associated with vomiting and blurring of vision at that moment, especially in conditions.
I think we missed that part
And
where, Dr. Debeila, I think we missed that part. You said what? That is coupled with what?
so let me say that again.
Yeah.
For closed ankle glaucoma, which will present as acutely, so the patient will have a red eye that is
Number one.
painful,
Okay.
so painful that it can even cause them to vomit.
Oh, yes.
Then they will have poor vision, and also it gets worse, or it's provoked by them being in the dark. So those are the symptoms of acute ankle closure glaucoma. But in terms of the open ankle, which is a chronic condition, some of the complaints would be that issues of contrast, what we say contrast sensitivity, in terms of issues with driving at night,
yeah,
and seeing color.
Dr. Debeila?
The rest of the things around, they only see the center of any object. But
Dr. Debeila?
Glaucoma, which is going to be like hard. You're going to be asking, but how do I know if I've got blurred vision, is glaucoma or cataract? That's when you must see the health practitioner to differentiate. But yes, poor vision, glaucoma.
Poor vision, glaucoma. Blurred vision?
Yes, blurred vision.
What causes it? What causes it? Dr. Tlailane, I met somebody in my life who, during the apartheid regime, the police went into his family's house and they grabbed them because they were young men and they slapped him on the eyes. And after that, they had a light switched onto his eyes for a period of time. He had to look into that that place. If you close your eyes, they slap your eyes. And so right now, at some point, he would have his eyes needing drainage. So what causes it? Something like that can it cause glaucoma, Dr. Debeila?
Yes, definitely. Definitely trauma is one of the causes of glaucoma.
So even in accident?
Structures that...
Even an accident can cause that
Please
if the eye is affected?
Yes. Definitely trauma is one of the causes. Like you said earlier, that this is an umbrella of diseases. So it's the common one, the commonest glaucoma, it's idiopathic. In other words, it does not have a cause. It's like a high blood pressure that happens in the elderly people. It does not have a cause. It happens just because people are aging, or from like genetic predisposition of that.
Yeah.
Then the other things that are causing glaucoma, we call them secondary causes. It could be anything. Diseases in the eye that can happen inside the eye can cause glaucoma, like you having uveitis, an inflammation of the eye inside the eye, can give you glaucoma. The lens itself, the cataract, when you talk about people having a cataract sometimes, if not taken care of, it can swell up and actually like close that ankle that I spoke about, or its particles can leak and block the drainage system of the eye. So those are some of the few causes. Even the trauma, like we mentioned, if you get hit and then there's bleeding inside the eye, it causes the closure. Lots of conditions. And also some medication as well.
Yeah. Dr. Tlailane?
Yeah.
Like I know one of the drugs that is taken for Duramine, that is taken for migraine, can even cause glaucoma. The use of steroids, some people are so-called steroid sensitive. They respond to the use of steroid and then they get high eye pressure.
Yeah. Okay. Dr. Tlailane?
Yeah, what I wanted to illustrate, not illustrate as such, but to comment on, and that is glaucoma being the second leading global cause of blindness.
Yeah.
It's often overshadowed by the other disorders of the eye. And then I don't know if, because there's a there's a fine line between cataract and glaucoma. As far as symptomatology is concerned. And then I would just like to understand from Dr. Debeila what other disorders of the eye could one be looking after, so that you can exclude glaucoma clearly before it comes to be, inoperable or cause blindness.
Like it's too late by that
because
time.
it's too late, yeah.
Dr. Debeila?
Okay, so if I get your question is that what are the other conditions that can mimic glaucoma in the eye
Correct, yes.
besides cataract?
Yes, that's because they overshadow the diagnosis of glaucoma.
Okay, so anything that can blur vision or can cause tunnel vision
Right.
can mimic glaucoma. So other things that can blur your vision, it's conditions that affect your refraction, conditions of the cornea as well. Like if you have a minor corneal scar, it could also be glare and blur, and also that can be mistaken for you having glaucoma. The second one also that can give tunnel vision, it's a very also usually an inherited disease at the back of the eye called retinitis pigmentosa. But main thing about retinitis pigmentosa is that people get the main symptom is there, it's night blindness, but also it's still the symptoms as well, because also with glaucoma, blindness start more at night before it also go to daytime, which speaks of that issue of contrast sensitivity that I spoke to about.
All right.
Okay, yeah.
Sure. I'm asking myself a question here. But family, you can ask questions. We're talking eye care, but we are focusing on glaucoma. But I believe you can ask anything on eye care since we have an ophthalmologist, Dr. Debeila, who can answer your questions. And I see Kenneth Kopase, I'll come to you. I think you're asking a question there. Moruti Muchalifa, hello. He says, I'm watching. Thank you so much for that. We are learning together. I'm thinking, Dr. Debeila keeps going back to the night blindness, the night where you have issues.
Impaired vision.
Yeah, there are some people during the day they want their phones or their screens to be light, and then in the evening you dim your screen. What about that? What and what is that called, Dr. Debeila?
So let's there's a difference between light sensitivity and night blindness.
Okay.
So like now what you're describing is more of light sensitivity.
Okay.
Right.
And it's also a symptom of other conditions, but the more one it's from digital eye strain, which leads to people having dry eyes, and then the light become light sensitive. But the most dangerous thing that we worry,
Dr. Debeila,
I spoke about uveitis. Yes. So if your light sensitivity is associated with a red eye or pain, then that is uveitis.
So
but
if you are driving at night,
it's a minor problem if it's just light sensitivity. But now vision at night, not able to see well at night, it's a different.
Oh, okay. But now if the sensitivity is coupled with pain at night, say you're driving at night and there's pain when you're meeting up with the other lights or whatever that happens there, is that a concern if there's pain that's coupled with the sensitivity?
The connection, please say that again.
If I am driving at night, okay, let me not use me as an example. If somebody's driving at night,
if I have driving,
if somebody's driving at night and then there's this, you find you're so sensitive to the lights that are coming from other cars, then there's pain that comes with that sensitivity. Is that a raise for concern? Is that not just sensitivity?
It is definitely a raise for concern.
Okay.
And one should get it checked out. Because it could be from like a minor problem of dry eyes to something that needs to be sorted with spectacles, astigmatism, to a cataract, and then glaucoma as well.
All right, let's hear what
and even corneal scars as well.
All right, let's hear what Ntate Kopase says here.
Good morning, Bongi.
Good morning,
Your
sir.
honorable guest, the doctor there, and radio pulpit family. I just have a case here. I'll just do it as a case study or a scenario because I don't want to be precise for, security reasons. This gentleman, the right eyeball is growing faster than the left eyeball. And doctors, once they don't know what's happening since he was a child. So they think it's going to blast maybe eventually. So doesn't want to go to this surgery or whatever they want to check. And so I want to know what is the doctor's advice to this gentleman, because Vele is a gentleman.
All right.
Thank you very much. Kenneth Kopase, Gauteng,
Thank you.
Johannesburg.
Thank you. A gentleman eyeballs are not growing the same. The other one grows more bigger than the other one. And now the doctors are saying that it might burst. That is scary to hear. Dr. Debeila.
Okay. Let me ask you a question. Sorry, there was breakup from the listener.
Yeah.
Did he say he's a child or is an adult?
He's an adult. He's a man.
Is a man.
Yeah.
Okay. So very little chances that the eyeball of an adult will grow. So we expected in a small child that if there's a pressure in the eye, because also they can get glaucoma. The kids can also get glaucoma that they're born with, or they can get it in the young ages as well. So that's when actually the eyeball, in trying to compensate for that pressure, it stretches and grows, but not in an adult. So if that happens in an adult, it's most likely there's something that is pushing the eye outward, causing it to have what we call proptosis or exophthalmos. The eye is getting actually pushed outward.
Aish.
So then that person needs to get a scan or some form of an imaging to the eye and the orbit to see what is pushing the eye out.
So it's not that the ball is growing, it's pushed out. So it's coming out. So it looks like it's growing.
Most likely, yes.
Okay.
Actually,
yes, Dr.
Yeah,
Tlailane.
I think on following that, I think, that the patient is advised to go and see the doctor. Should do it immediately, because I was thinking, as she was asking, I was thinking of a tumor that could be growing.
That could be pushing the eyeball.
Pushing the eye. And then we also have this thyrotoxicosis that we find with patients who have got the hyperactivity of the thyroid gland. It causes them to have eyeballs, protruding. But usually it's bilateral and not unilateral, unless in some other rare instances where you get the protrusion of an eyeball from thyrotoxicosis being unilateral. So I think, advice is that you must come and see us. We'll refer him to Dr. Ophthalmologist. Yeah.
All right. A second question says, sometimes I see little black dots, strain my eyes to see if it is real, or is it particles of dust, but it happens when everything is still okay. Okay, I'm not quite sure there, because I just I'm losing. So this is not right. What's happening here? It's not right. But you've heard a little bit of that, Dr. Debeila. What is your take on that? I just want to quickly go back to that message. Okay, let me finish it.
So
Let me finish it. It says, I strain my eyes to see if it is real or is it particles of dust. But if it happens when everything is still, I do have hypertension. Okay. So, yeah, that's the whole question right there. Dr. Debeila? Dr. Debeila? Okay.
Okay, I got the question, even if I didn't get it clear. But
should I quickly read it again?
I think the listener is asking about floaters.
Oh, okay.
Yes. So floaters, like I said, that an eye is a closed system. It's an eyeball. So inside the eyeball, just after the lens, from the front going to the back, just after the lens, there's a gel that is keeping the eye formed that we call a vitreous humor. So when people start seeing floaters, whatever is happening, it's happening in the vitreous. from the least dangerous of things is that it could be that vitreous condensations that happens with what? With aging, causing the floaters. The worst case scenario, it could be that you're having the retinal detachment. The retina at the back of the eye, it's off. So looks like it's something that is floating in the retina. So it's always better to get it checked out and then relax and know that you are sorted.
Okay.
If it's just a mere condensation floaters, or it could even be blood or anything, inflammatory cells floating in there.
All right. Let's take a break.
And some people would complain that they see some things flying.
Yes. And something that moves with the eye, like a certain structure. It moves with. I remember when I was growing up, let me ask as we are going to an ad break. When I was growing up, I remember reading an article where they said we shouldn't look at the sun because the sun can cause that. How true is that?
Not exactly. That will be like a temporary phenomenon of just what after looking at the sun.
Yeah.
It's just the physics of the eye having exposed to too much light. That time when you start seeing things floaters, it's just an instant reaction. But the main thing of looking straight to the eye, it can also damage the back of the eye, the retina. We can kill what is called solar retinopathy. So the retina can get damaged by those UV lights, strong UV light that you're looking at.
All right. Let's
okay. Just before you go
to an ad break.
Yeah. You know, when we were growing, we were told that the albinos, people suffering from albinism,
yes.
Can see better at night, and I'm not sure how true that is.
Without the melanin on the eyes, because they lack the melanin, right?
They just can see better than an average person.
How true is that?
Yeah, that's what I want to find out.
Dr. Debeila?
So they definitely don't have a poor vision in terms of compared to an average person. They've got a poor vision. And the reason why, when they lack melanin on the body, they also lack the pigments in the cells that are needed for a photoreception. Do you remember we've got those rods and cones, and then we see? So for them, night vision is better. It doesn't necessarily mean that they see better than us at night, but night vision is better for them compared to day vision.
Is it because maybe it's relaxed because of the darkness? So they are more relaxed, no lights disturbing rays. I don't know. But I'm thinking, could it be?
So in terms of so for us to see, remember there's so-called photoreceptors, those cells that sense the light. So there's ones that work for dark conditions, then there's that work for light conditions. Okay. There's rods and then there's cones.
Okay.
Yes. So for them, the ones that work during the day, the cones are more disturbed.
Okay. All right.
Let's take more affected.
Okay, during the day. Let's take an ad break and then come back with you, Dr. Debeila. Time flies and we are learning a lot today. We got one more question when we come back.
Word deel van 'n naweek vol opwinding. Bespreek nou jou plek vir die Radio Kansel kuier naweek by Klein Kariba. Kom kuier en kamp in 'n chalet of jou karavaan saam met die goeie nuustydspan van 24 tot 26 Mei. Heerlike pret en ontspan vir die naweek met 'n musiekaand om die swembad met teewildgous, kapperjolsport en skattejag. Moenie jou vleis vergeet vir die bring en braai nie. En o ja, onthou jou Bybel vir Sondagoggend se erediens. Vir meer navraag, kontak vir Wynand by wynand@radiokansel.co.za.
Oxford Lodge, with its magnificent gardens, is situated in the centre of Vryheid in KwaZulu-Natal. With 36 luxurious rooms and fully equipped function and conference facilities, it is the ideal venue for any event. The historic value of the area adds to the unique experience of a visit to Oxford Lodge. Contact Oxford Lodge at 034 980 9280 or visit theoxfordlodge.co.za.
Join the International Marketplace Summit on the path that will unlock your kingdom wealth. This business empowerment seminar with 4 dynamic marketplace speakers will take place on the 6th of April at 9 o'clock in the morning at 7 Kings Road, Wendywood, Sandton. Entrance is free, but registration is required. Book your seat now on our WhatsApp line at 063 361 4417. You cannot afford to miss your date with Destiny. Join the International Marketplace Summit.
You're listening to Radio Pulpit, your daily companion, 657 AM. This is Where You At. Just for You is the name of the show. We're saying goodbye to you in a short while. We left with few minutes. I was saying to Dr. Tlailane, time flies when we're having a great time. My family, do remember that this weekend is going to be very busy. Tomorrow, you are with Mpoputini and Berta Leroux on N3 Petroport. On Saturday, we will be at with Enika Mantra. We will be at the Christian Fellowship Healing Church in Kwamhlanga at Pastor Mkhize's church. And on Friday, I skipped Friday. Friday, Bahlen Hlapo will be at Zone 10 at, what do we call it again, at Lihlabile, at the By the Stone Ezel Church, going there with Enika Mantra. And on Saturday, Rifule Lamula will be at the Rent Easter Show, and she'll be broadcasting live there. Radio Pulpit is already ready to receive you there. And on Sunday, Ayanda Nenemba is going to Rock of Ages at Sekunda at Dr. Mabunda's church, together with the team, and another team will be at the Rent Easter Show. And on Monday, we are closing the weekend at the Rent Easter Show on Heart to Heart. Right now, I am with Dr. Debeila, who is our ophthalmologist, on his besoek met Dr. Tlailane. Ons praat oor glaucoma. And my family, I said if you have questions that you can ask, you can. Dr. Debeila, I think this one, it needs a private matter. It's a private matter kind of a thing. We can't say it on air. So if you can send the message to Dr. Tlailane, so we can send it to our family member of Radio Pulpit. The question is, good morning, Spongile, and the ophthalmologist mentioned a migraine tablet that causes glaucoma. Please send me the name of that tablet. And if there's any other tablet that can cause that. Is there another one, Dr. Debeila? Dr. Debeila?
Not that I can remember by heart. But like I said also earlier, that steroids in general are a risk factor for glaucoma.
Okay, this other one is very long. Let me try to run because we are left with literally like 3 minutes or so. Good morning, Spongile and doctors. 2 months ago, I had an eyelid examination, punch biopsy. The specialist said she is happy with the procedure. I have developed something in the corner of the same eye. The specialist doesn't know what it can be. She said she doesn't want to perform another operation. She prescribed Spesardex comp eye drops, hoping it will cure the problem. I'm seeing her tomorrow for a follow-up. Sorry, I can't say exactly what the problem in the eye is. She did say what the possibility could be. Where is it? Could be, but I battle to remember and to explain to anyone. I hope you can shed some light onto the problem. Thank you. God bless you for being a great blessing to us. And this is Carol. Do you think you have something that you can share on that, Dr. Debeila?
It's a bit difficult though, because if they had the biopsy, then there should be results of that biopsy as to what happened. What did the lab find on the specimen that was sent to the lab? And if the doctor is not going aggressive in terms of management, and Spesardex comp is a combination of steroid and antibiotics in a drop. So it's probably like an inflammatory problem that needs to be sorted out. But they must really communicate with the doctor and most importantly, ask for that histology results. What are the findings of the histology?
All righty then. Okay. Dr. Moruti Khomotomaga, I think now I've already blessed you. You are Dr. Khomotomaga. Good day to you. Thank you so much for joining in. Dr. Tlailane?
No, I was just saying maybe this patient has got a concomitant, what we call pterygium, which is a tumor which arises from the sclera of the eye. I don't know if Dr. Debeila could comment on that, on the pterygium. that could be there but not have been seen, or maybe the doctor doesn't want to deal with it then. He's just dealing with whatever he found on the eyelid.
Dr. Debeila?
Because from the question I got is that this is an eyelid problem. So it could be on the eyelid, like the benign things on the eyelid could be like something as simple as a pyogenic granuloma, which if I have to put it in simple terms, I'll say I would equate it to a keloid. If that's what could be happening. Then also like warts, like all the warts, papillo warts. So those are some of the benign things that could be there that are taken out and don't need any further intervention. But now when we speak of the pterygium, that is now it's actually on the conjunctiva. It's actually like sort of a reaction scar tissue that is overgrowing, and it goes to the cornea. And then there's stages when we say now we have to take it out because we see now it's affecting your vision, or it's going to affect your vision because it's causing astigmatism. Or when we give you treatment and then it's not responding to the treatment, then we take it out. And some people just want it out because they don't want to see it. They don't like it.
Sure.
Yes. And also that is also not a problem as well.
All right. I think we need to release Dr. Debeila. Thank you so much for educating us today, so for empowering us today. I think we need to come back with her for another topic. And we're hoping that you'll be back in SA when we have another topic with you.
And she can be in the studio, you see.
Yeah, so she can be in the studio.
Okay, I'll also love that. I'll also love that.
Thank you.
Thank you so much.
Thank you very
so
much,
for
Doc.
having me on the show, and have a blessed Easter, and God bless.
God bless you too, and have a beautiful one too.
Enjoy
the big five. Yako Zimbabwe. Bye bye. Dr. Tlailane, thank you for connecting us to Dr. Debeila.
Thank you very much.
This
is quite awesome. A complex, ophthalmology is quite a complex thing. The way they operate, they use microscopes,
I know.
And very minute sutures, that you can't see with bare eyes.
But at the end of the day, they help people, God's people to see much better. Yeah. Dr. Tlailane, thank you so much. For family members seeking to talk to you directly, how do they do that?
You can contact me on my cell phone after 6 o'clock, 078 738 2694.
078?
078 738 2694.
All righty then. Thank you so much. I'm also signing out. Let's meet my family tomorrow. I'm not at the N3. I will only be at Kwamhlanga on Saturday at the Christian Fellowship Healing Church. But tomorrow, go to N3 Petroport and meet with Bertha Leroux and meet with Mpho Putini. And on Friday, meet with Bahlenhlapo at Zone 10 at by the Stone of Ezel Church. And on Saturday, yes, I said it. And on Sunday, go meet Ayanda Nenemba at Rock of Ages in Secunda. And on Saturday, again, you can meet Rifile Lamula at the Rent Show. And on Monday, we're closing our heart-to-heart at the Rent Show. And on Saturday evening, I will be coming through with the Ultimate Lifestyle Guide from 4 o'clock up until 7 o'clock. Leaving you with the sounds of God. Better God is able. And next up is Germany, Yanni Belsa with Perspective. Do enjoy Perspective and do enjoy the rest of our Radio Pulpit shows. We love you, love you, love you, love you. Bye-bye.